A growing Ebola epidemic in the Democratic Republic of Congo has killed more than 1,000 people since August. The World Health Organization reports the rate of new infections is climbing substantially. Nearly half of the deaths have occurred in the last 8 weeks.
So we're flying from San Diego to Congo with 8 crates of supplies to go and do our laboratory research there and bring the data back here.
Erica Ullman-Sapphire is a professor at the La Jolla Institute for Immunology. She also directs a consortium of Ebola researchers from 40 labs on 5 continents. She says the difference between this Ebola outbreak and the outbreak in 2013 that killed 11,000 people is a candidate vaccine that is currently being used in the region. It could help stop the spread of the highly contagious virus, but there are challenges.
The challenge to stopping it is going to be all the civil unrest. There were multiple groups, multiple militia groups, or significant distrust of institutions, of governments, significant distrust of foreigners. So it's really hard to come in there and say, here, take this vaccine, or let us take care of your people.
She says approximately 100,000 people have been vaccinated out of the nearly 8 million people who live in the region. Most of the vaccinated have been health workers and people who have come into contact with an infected person.
It looks so far like only 15 of those have become sick. The data that we don't have is how many of those 100,000 have been exposed, and that will tell us how effective the vaccine is. If 100,000 have been exposed and 15 got sick, that's a really good vaccine. But if only 20 were exposed and 15 of those 20 got sick, that's not a very good vaccine.
According to the World Health Organization, the Ebola virus spreads quickly and is usually fatal. Symptoms include fever, vomiting, diarrhea, muscle pain, and internal and external bleeding. Ullman-Sapphire's team is studying samples from people who have been vaccinated and samples from people who have come into contact with an Ebola patient.
Students, postdocs, and technicians in my laboratory from the La Jolla Institute of Immunology have been rotating in and out of Congo all year, using the molecules that we make and that we engineer here to identify cases, understand what kinds of immune responses have been elicited by the vaccine, and how broadly protective the vaccine may or may not be.
She says the current Ebola outbreak is deeply concerning because the virus is spreading in a dense and highly mobile population near the border with Uganda and Rwanda. But she says even more concerning, there are at least 5 other strains of the Ebola virus that have equally deadly pandemic potential.
There are 6 different kinds of Ebola virus, and they're about 50% different in the sequence that spells them out. So the vaccine is only protective against one. We call this the Zaire kind. Well, there's also the Sudan kind, the Bundabujo kind, the Bombali kind, lots of kinds. And each one of them has equivalent pandemic potential, but we don't know what's going to emerge next.
She says studying the antibodies Ebola survivors have made is key in finding a treatment.
We're looking at people that have survived. We're looking at elderly people with a lifetime exposure of hunting, of eating bushmeat, or of healthcare work that are now immune to all of these different species. And we're looking at what their immune system has come up with to protect them.
She's mapping the virus's molecules using high-resolution photographs to understand where the virus is vulnerable and where to target a therapy or vaccine. She compares it to military intelligence photos.
When we know how to drop a bomb on a particular bad guy in a particular chair, sitting in a particular room, in a particular compound without collateral damage, it's because we had those high-resolution photographs that tell us exactly where to hit. This is what my lab does against viruses like Ebola. We take these high-resolution photographs to figure out how does the virus infect? Where is it vulnerable? Where can we target a therapeutic? Or how do we design a vaccine that's going to beautifully mimic this virus and give a person immunity before they get exposed?
For Ullman-Sapphire and her team, the Congo outbreak and the potential of related viral outbreaks has renewed her urgency to find a cure.
And so we need to be prepared for what might come at us for the next outbreak. We need vaccines that are broadly protective, and we need treatments that we can mobilize for whatever people might have become infected with.
Ullman-Sapphire is planning to return to the Congo to study Ebola this summer. Susan Murphy, KPBS News.